campaign with President Trump all across North Carolina. And one of the things that he talked about was repeal and replacement. Now, when he said that, it took on two different meanings. A repeal to many meant that we would repeal the entire Obamacare plan, all the taxes, all the mandates, the Medicaid expansion. And when he talked about replacement, it took on another meaning to others, which it meant that we needed to cover the pre-existing conditions, making sure that people didn't get kicked off of their health care plan, making sure that there was an adequate safety net. I can tell you that those two things are still the focus of not only the House Freedom Caucus, but my good friends, Senator Lee, Senator Rand Paul, and Senator Ted Cruz. And as we look at this today, we're going to be talking about a number of scores in the upcoming days. CBO scores and what score and that this means and what does it mean for the American people. I can tell you that there is one score that the American people will pay attention to. And that is does it really lower their health care costs and their premiums? That's the only score that really matters. And if this doesn't do it, then we need to make sure that we find something that does do it. And with that, I'm going to turn it over to the gentleman from Ohio who plans to introduce a piece of legislation that really repeals the Affordable Care Act. The gentleman from Ohio, Jim Jordan.
Thank you, Mark. Yeah, Mark's exactly right. Our goal is real simple: to bring down the cost of insurance for working families and middle-class families across this country. In an effort to do that, we think you have to get rid of Obamacare completely. So tomorrow I will introduce the bill that every single Republican voted on just 15 months ago, the bill that actually repeals Obamacare. Our plan has always been repeal in one piece of legislation, replace in the other, and that replacement we talked about a few weeks ago is the bill sponsored by Dr. Paul in the Senate and Mark Sanford in the House. Make no mistake, there are three plans out there. There's the Cassidy-Collins plan, which is basically if you like Obamacare, you can keep Obamacare. There's the leadership plan that was brought forward, which I believe, when you look through it, is Obamacare in a different form. And then there's our plan, the one that I think is consistent with what we told the voters we were going to do. Repeal Obamacare, replace it with a market-centered, patient-centered, doctor-centered plan that actually brings down the cost of insurance, brings down the cost of health care, and provides affordable insurance opportunities for all Americans. That's what we're focused on doing. Think about this. We put on President Obama's desk a bill that repealed Obamacare, got rid of every single tax, got rid of the mandates, and now the first thing Republicans are bringing forward is a piece of legislation that we're going to put on a Republican president's desk that says we repeal it, but keeps Medicaid expansion and actually expands it, that keeps some of the tax increases. That is not what we promised the American people we were going to do. So our plan, repeal it, clean repeal, just like we all voted on before, separate legislation to replace what we currently have with a model that we think will bring down the cost of premiums for the hardworking people of this country who sent us here to do just that. With that, I want to turn it over to the sponsor of our replacement plan in the Senate, Dr. Rand Paul.
Today I will introduce a companion bill also to Congressman Jordan's plan to have complete repeal, a clean repeal. We'll be doing this in the Senate today as well. There's one thing that has united Republicans in 2010 when we won the House, in 2014 when we won the Senate, and in 2016 when we won the White House. This doesn't divide Republicans, this brings us together, and that is complete repeal, clean repeal. As Congressman Jordan said, we voted on this last year and every Republican voted for it. That's what we should do again. But we are divided. We have to admit we are divided on replacement. We are united on repeal, but we are divided on replacement. What's the best way to get past this impasse? Let's vote on what we voted on before, a clean repeal. Let's separate out the replacement plans. Conservatives have a replacement plan. House leadership has a replacement plan. I'm sure Democrats would like to go back and vote on the HCA again. Vote on all the replacement plans and let's see what happens. All right? But let's vote on clean repeal. The only way I think this gets done is to separate the issues. Separate out clean repeal from replacement. Let's get it done. Repeal unites us, and I think we can get that done. With that, I'd like to introduce my colleague and friend, Senator Mike Lee from Utah.
What's been introduced in the House in the last 24 hours is not the Obamacare replacement plan, not the Obamacare repeal plan we've been hoping for. This is instead a step in the wrong direction. And as much as anything, it's a missed opportunity. Look, we've seen what happens when Congress decides to put forward a plan negotiated behind closed doors, where members are told you've got to pass this bill in order to find out what's in it. It's usually not a good product. And on this topic, I'm not speaking about anything that is necessarily inherently Democratic or Republican or liberal or conservative. This is just a common sense value. That what we ought to have in Congress is an iterative process, one in which we can start with basic grounding principles. Now, the two parties are in widespread disagreement when it comes to Obamacare itself. But there is one plan and only one plan that has so far passed a Republican Congress. And it's this plan that's being reintroduced today. That plan passed with the support of every Republican in the House of Representatives and every Republican in the Senate. And it did so just in the last 14 months. So I think we ought to put this forward. We ought to get it passed, and then let's move the ball forward in an iterative process. A process in which people can propose different ideas that will benefit the American people. That's what we want to do, and that's what this process, this bill, the 2015 repeal bill, would do if we were to pass it right now.